Hello, my dear friends. I am Dr. BV Balachandra. I'm a consultant pediatrician and allergy asthma specialist. In this section of the video, I'm going to speak on 6 steps in managing your allergies. Allergies are chronic disease. They are present for very, very long time. It affects the patient's quality of life. It affects patients' day-to-day activities and how they perform in their real life. Many of the patients ask us whether allergies are for lifetime. Should I be on medications for lifetime? Now, since the allergies are long-term disease, the treatment also goes for long-term. However, there are many methods which can be applied to decrease the medications, sometimes even come out of the medications completely. The large effort of this, whether the patient will come out of the medications or not, depends upon a lifestyle change and doing certain things which patients or parents should understand about this and follow this day to day. This will help us a lot to reduce the medication and coming out of the medication. Now, these 6 steps is been divided into, first and foremost is education and knowledge about your diseases. Here, I'm going to focus on only respiratory allergies, that is your nasal allergy, that is allergic rhinitis, and your chest allergy, that is asthma. The second part of this second step is avoidance. What to avoid, when to avoid, how to avoid. The third part is nutrition. What food to give, what can make an allergies worse, and what to avoid. I will be discussing on that. The fourth step is the medications. How the medications will be advised to you and what you should follow them regularly. That will be discussed. And the fifth point is natural methods. Breathing exercises, yoga, all these components will be covered. And the last step would be, the sixth step would be immunotherapy, wherein to see to that the patient who is allergic to certain things, his body can start tolerating to that by starting immunotherapy. Now let's start with first component, that is education. Education is a key for a long-term achieving any goal. Now, in your allergy management, if you are a patient or if your child is suffering from any allergy, you need to have a good knowledge about many things like what are the allergens, what is this allergy is all about, why did your child or yourself got this allergy, and what actually happens in your body when you get exposed to an allergen. This education will help us a long way in managing the allergies. Let me start with allergens. Allergens are usually harmless, small, microscopic particle component of it, which generally all the human beings are getting exposed to that. But all of them tolerate except few percentage, about 5 to 10% of the people who are getting exposed to the same thing which other people are getting exposed, but their body is reacting to that. Their body is fighting against that. Now let's take an example of dust mite. Now dust mites are present inside the bed, pillows, soft toys, carpets of every house. Everybody are getting exposed to that. In fact, dust mites' food is actually human skin, human dead skin which falls on the bed is a food for the dust mites. It feeds on our skin, releases its saliva, fecal particle and skin particle. Those particles goes inside our nose or throat or chest. The bug itself cannot go into the nose and throat and chest. Its particles gets into the nose, throat and chest. Those who are allergic to these particles, they are the one who are going to react. Most of them who are tolerant to that, they will get exposed but they will not have any symptoms at all. Same thing holds good to the pollens. Pollens are present everywhere, grass pollen, tree pollen, weed pollens. Many of them are getting exposed, but few of them who are allergic to that, they will react. Same thing happens to the food. Let it be peanut or a egg or a fish or tree nuts. All of us are eating that, but for few of them, it can be very dangerous. Same thing holds good to certain insects also. So now, what is this allergy? Now we spoke about allergens. Now these allergens, when it comes in contact with our body, as I told, most of us tolerate, but some people who are genetically prone for this, they start fighting against this allergen, if the fighting happens inside the nose, the result of that is sneezing, nose itching, nose leak or nose block. That means an allergen is gone into the nose and our body immune system is fighting inside the nose. The same allergen, if it enters into the chest and our body interacts with that, then we'll have cough, chest congestion and wheezing. So this is what is allergy. What everybody are getting exposed. Some people, instead of tolerating it, react to that and cause symptoms. That is what is allergy is all about. Now, you might have a question. When everybody are breathing the same thing, why am I reacting? How am I different? Why am I reacting to that which everybody are tolerating it? Let me explain this in a simplistic this picture. You see that a non-allergic person and an allergic person. Now, our genetics play a huge role. Where do we get our genetics DNA? From our parents, grandparents and grandparents. Sometimes, even if you don't have an allergic history, your body can become allergic, but there is mostly a family history towards it. Our immune system is controlled by our genetic component of it. Now, if we have a genetic tendency of an allergy, our immune system, how it is going to behave is, say that when we have any infection, like say a wound or a typhoid or a COVID or malaria, whatever, what is our immune system supposed to do? Our immune system is supposed to fight against it. It is supposed to show a reaction towards it. But certain harmless things like dust mite dander or a pollen or a food, when it comes in contact with our body, our immune system should not fight with that. Our immune system should tolerate that. That's what happens in a non-allergic person. Whereas in an allergic person, as soon as our immune system comes in contact with an infection like typhoid or skin infection, our body will fight for that, which is correct. However, if our body immune system comes in contact with dust mite dander or a pollen dander or a food, in an allergic person, the immune system fights against that also, which is wrong. Our immune system should not fight against dust mite dander or a pollen or a mold or a fungus. Our body should tolerate that. Now here, the immune system is working in a little wrong direction. It's not supposed to fight against these harmless substances, but it is fighting against it. So that is the actual root cause or a problem of allergy. What is allergy happening is because the immune system is working in little wrong direction. Many patients think that because they get frequent cold, cough, congestion, they think that their immune system is very low. It's not that immune system is low, it is that immune system is good, but immune system is also little working in a wrong direction. Now, I've already told this, when an allergen enters into the body, if the person is allergic, then the symptoms will start happening. Say allergen like dust mite or a pollen enter into the nose and throat and chest. In an allergic person, the interaction happens and the symptom starts coming up. Now, where the reaction happens, symptoms are different. If it is happening inside the nose, it will be leak, block, sneeze, itch. If it is happening in the chest, it will be cough, chest congestion, wheezing, breathlessness. Now let's look at what happens in the life of a person who has got allergy or allergic symptoms. Now there are symptoms can be divided into two groups, that is direct symptoms and indirect symptoms. Now if a person is having a nasal allergy, he will have leak, block, sneeze and itch. If a person is having an eye allergy, then it will cause redness and itching. If a person is having a chest allergy, he will have cough, wheezing and breathlessness. These are the direct symptoms. What we see as when your doctor sees or examine the patient, on the nose, you can have that mark on the nose which is called creases on the nose, and patient might be rubbing the nose frequently because it is itching. Foul smelling might be there. Your other person might tell that he snores a lot. That is because of the block. In the ear, there is usually recurrent ear infection, ear pain, which is happening, and this can lead to a decreased hearing. And many patients have a decreased hearing and they need loud sound to hear. When we see the throat, and throat can have little kind of a nodules called pharyngeal nodules, and these patients might start doing this throat clearing sounds, some kind of a sounds which they produce on the throat. Usually these children or these patients' sleep is definitely affected. They might sleep for about 8-9 hours, but they are not fresh next day. They are still kind of a decreased energy level. They might sleep in the daytime also because they've not got the peaceful, good quality sleep in the night time. Now, these are the symptoms which happens for allergy symptoms directly. Indirectly, what happens? Because they are sneezing or coughing or anything, it's an embarrassing situation in the group or in the school. Now, these patients also have nose leak, and these patients also have behavior is little on the aggressive side. The reason is they did not have a good quality sleep. When they don't have a good quality sleep, their behavior definitely gets affected. And we have seen that many children have a poor school performance, decreased performance in the maths and science. And in fact, I would like to mention that nose allergy, which is usually not taken very seriously, is one of the most common reasons for a child to miss the school and for an adult to decrease his work performance and go for an absenteeism. In summarizing the whole thing about the education, allergens are non-visible components like a dust mite dander or a pollen component or a pet dander, cockroach dander, and they are present everywhere. And when they come in contact with an allergic person, they will cause symptoms. When they come in contact with a non-allergic person, it won't cause any trouble at all. It's our immune system which is working in the wrong way. It is not that those children have a less immunity. Now, there are many irritants like smoke, pollution also can worsen their symptom, but they are not allergens, but they are capable of worsening the symptom because of their property. Please note, allergies disturb day-to-day life and affect the quality of life significantly. So till now, we have covered education component, that is one step. Now this knowledge, whatever you learned till now, is very important for us to understand the next steps. The next step which I am going to discuss is avoidance. Many of the patients come and ask us, what should I avoid? What food should I avoid? Why am I getting these symptoms? And by avoiding, can my life be more peaceful? Now let's look into that. One important thing is, please don't avoid anything blindly. You need to have a sufficient evidence to know that this is allergy and this you should avoid. Otherwise, avoiding too many things unnecessarily, life gets too much compromised. And many patients and many children are avoiding so many foods, they are actually not allergic to that particular patient at all. So unnecessary avoidance is also not good. So what does your doctor do? He will understand your problems and then he will decide whether allergy testing is required or not, and then he will subject them for an allergy testing. Based on that, he will give you an avoiding allergens. There are certain irritants which cannot be tested but which are harmful. Also, avoiding certain infections is very important. What is allergy testing? Allergy testing is a methodology to identify whether a patient who is suffering from a particular allergy, to know that what component is allergic to that particular person, what component is making him get that symptoms. It can be in the case of nose allergy, it can be in the case of asthma, chest allergy, it can be in the case of food allergy or drug allergy. There are many methods of testing. Skin prick test is one of the important gold standard way of doing an allergy testing. So in the skin prick test, I'll tell you what we are going to do. There is another method which is called blood testing, which is also equally good, is used in certain cases. Skin prick test is a simple process where after discussing with the patient and the family, but we should make sure that the patient is not taking any anti-allergy tablets or syrups in the previous 1 week, and your doctor decides what allergens to be tested, and he'll put a drop of each allergen on the skin, and a micro level of prick is done on the skin. It is usually a painless one. Okay, even when we do it for a small children, they don't even feel that. So it is not at all like an injection. It is like a 1 millimeter micro prick. So when it is done, after 15 minutes, we see that whichever the patient is allergic to, that area will start having some small amount of swelling like few millimeters. That will tell us that that component is causing trouble to this particular patient. There's another method is a blood test. In the blood test, we run a take a few about 2 ml of blood and run a series of allergens, what needs to be tested, and based on the report, we will try to interpret with that. This is another method of doing allergy testing. What all allergens that we are going to be include? Generally, allergens can be categorized into specific group of things and a non-specific, that is general group of things. In the allergens, what we are going to evaluate in a patient is most common things are dust mites. And I'll also talk briefly on how to avoid these dust mites. Dust mites, as I told, is microscopic component which is present inside the bed, pillows, soft ice carpets, and most 95% of the exposure happens in the bed. So there is something called bed care, a special mattress cover and a pillow cover when it is put to your bed. If you are positive to the dust mite, please note that you will apply what you are positive to. Don't try to apply everything. So if you are positive to the dust mites and if your doctor tells you to avoid, then you are going to follow this. The dust mite proof bed care covers, pillow covers should be used. They are kind of woven at a structure at a distance of 4.8 microns. So that means the dust mite coming outside, the chances are little less. Not like 100%, but it will reduce significantly the dust mite coming outside and coming in contact with the human skin. The probability of your symptoms coming down is there. Apart from that, you need to see to that the carpets are completely removed from the house if possible. Otherwise, at least weekly once, cleaning it and vacuuming it. Also, your bed sheets, blankets, everything should be washed with hot water. Cleaning of the house is preferably vacuumed rather than sweeping or anything. As much as possible, avoid soft toys in the house. If at all the children are demanding for it, soft toys also needs to be washed with hot water, or you can freeze it in the refrigerator and then give it back, because either you freeze or wash it with hot water, dust mite count will come down. This is one of the way to reduce the dust mite. The second thing is molds. Again, in molds, there are several steps in avoiding molds. That is, you need to keep a good cross ventilation. You need to avoid wherever there is a water leak in the taps or in the bathroom, kitchen. Keep the area dry and well ventilated. If already molds are there, there are something called anti-mold paints are there. You need to get it painted. All those things just to be followed. There are specific videos for allergy avoiding each one. You can watch that. Cockroach. Again, there are several steps in avoiding cockroach. As I told you, there are specific videos which we have developed for cockroach. You can watch that. Dog and cat is again a very difficult thing if you come across positive to the dog and cat to completely avoid. There are challenges, we understand that. But again, if your symptoms are bothering because of them, you may have to avoid. Please watch a specific video for that. And even the pollens. Pollens are very, very, very difficult to avoid because pollens are not in your house for you to control it. It is outside. There are different types of pollens like grass pollen, weed pollen, and tree pollens. And your doctor will discuss with you which months these particular pollens are most in the weather, so that you may have to avoid traveling outside at that time, wear a mask. So all these things can be discussed in a specific videos. Another important point which I want to mention is irritants. Many of the patients come and tell that I am allergic to smoke. I am allergic to the pollution. Please note that smoke, pollution, agarbatti, they are not the real cause for your allergic symptoms. The real cause are dust mites, cockroach, cat dander, or pollens. But these smoke can worsen your existing allergy to 100-folds. So that means an allergic person gets exposed to pollution, he will have bad symptom. Same as non-allergic person gets exposed to pollution, he will not have much problem because his nose is clear. So when your nose and chest is already damaged to some extent by the allergens, then these irritants can worsen it. Similarly, agarbatti or a doop stick or when you sleep, whatever the mosquito coil, you put it inside the house, perfumes, deodorants, or any smell which is smoke which is coming from the kitchen, all these things are capable of disturbing your nose and make your symptoms worse. You need to avoid these things. Many children are prone for infections, and as and when they get infection, they get severe cough, congestion, wheezing, and breathlessness. So you need to, as much as possible, avoid sick contacts. Please take a flu vaccine yearly once, and please discuss with your doctor about its beneficial part. So summarizing about avoidance, now unnecessarily don't avoid blindly. Always discuss with your doctor, get an allergy test done, prove what you're allergic to, and then avoid it. Avoidance is to be done in a more scientific way, and we need to focus on breathing clean air. Indoor pollution is more severe than outdoor pollution. In indoor, within the house, we pollute ourselves by using a lot of agarbattis, lot of perfumes, deodorants, mosquito coil liquidators, room fresheners. the chemical which is used to clean the houses, and the chemical which is used to wash the clothes, and for the fragrance of the clothes. Please note that God has not made all this component for us. We need to breathe clean, simple air which doesn't smell in any way. So, we have completed education, we have completed avoidance. Now let me go to the nutrition part of it. In the nutrition component of that, we are going to discuss 3 parts, that is food, weight management and vitamin D. In the food component of that, please note many of them have a misconception that many fruits, many vegetables are actually allergic to and they are avoiding that. It is very, very rare for a fruits to be allergic to, though I would say that there are some people who are actually allergic to the fruits, but as I told you, you need to confirm with your allergist, get it tested, prove it and then avoid. Please unnecessarily don't avoid many fruits, especially many people avoid citrus fruit which are rich in vitamin C. They are not the cause for your allergies. Now many of the respiratory allergies like sneezing or nose allergy or a chest allergy are caused by allergens what we breathe. It is rare that what we are eating can cause a cold or a sneezing or a wheezing or asthma. What we eat gets into the stomach. If we are allergic to that particular food, we will have symptoms in the form of oral itching, stomach pain or vomiting, diarrhea, rashes. These are the typical symptoms of food allergy. Okay? However, unless you prove it, blindly don't avoid, confirm that whether you are allergic to those food or not. Fruits and vegetables are extremely good for human health. You need to consume and they have a lot of antioxidants. They have something called phytonutrients which are very beneficial for us. So, what to avoid? As I told, don't avoid unnecessarily, but there are certain things which you definitely have to avoid is the junk food. Junk food contains lot of oxidants and causes lot of obesity, lot of damage to our health. And please note that most of the preservatives, any of the food which is kept for a long time and it doesn't get spoiled, like say packaged foods what you get in the shops, which are all manufactured few months or years back, but they are still consumed, it's because they are preserved. They have chemicals like additives, preservatives, coloring agents. So my request to all this is, as much as possible, please reduce the packaged foods. And also I would advise, avoid anything taking from the refrigerator and consuming immediately, because low temperature foods are the same food you can warm it and take it, but avoid a chilled variety of food. Also avoid going back to the bed within 90 minutes to 120 minutes after eating food. Minimum about 1.5 to 2 hours gap has to be given so that whatever you eat goes down below the stomach and the intestine, so that they don't come up and create a trouble in your throat and chest. When it comes to the weight management, overweight and obesity is a very, very big challenge in managing asthma. Those patients have a very difficult to control asthma. Please see that the weight is adequately managed, and weight reduction actually helps us to decrease the medications in allergy and asthma. The next component is vitamin D. There are a huge number of population which are vitamin D deficiency because of our lifestyle. Though we might be living in India with a hot sun weather, but we are not getting exposed to the hot sun. We're always inside the house or inside the car, inside the office. So there is no direct exposure of sunlight. It's very important that we get exposed to some amount of sunlight, at least in the first 2 hours of sunrise or 2 hours before the sunset. We need to spend at least 1 hour in the sun. That's very beneficial for allergy. When it comes to the food source, I've already mentioned, in the vegetarian food, there is a cow's milk, cheese, fortified soya milk, mushrooms, fortified cereals. These are all the sources of vitamin D. In the non-vegetarian food, it is fish, egg, chicken, and mutton. But most important source of vitamin D is sunlight. Vitamin D is also beneficial for us to reduce number of acute events, acute wheezing episodes. Now, in summary about the food is rarely cause for nose allergy and chest allergy. Eat all varieties of food. If you are suspecting any particular food you are allergic to, discuss with your doctor, confirm it, and then clarify it, and then decide on whether avoiding or not. Maintain your ideal weight. Avoid chilled food, eating immediately. Avoid junk food, and don't go back to your bed immediately after eating food. Now, the next important component, that is the 4th step, is the medications. There are a lot of confusions with respect to the medications which are used for nose allergy and chest allergy, that is asthma. Please note that many of the medications used for nose allergy or chest allergy, these medications are given directly to the nose or directly to the chest in the form of inhaler or nasal spray. It is very, very, very important that as much as possible, you reduce or avoid oral medications for these symptoms. Because when you give a medication directly to the nose or to the chest, the dosage used are in very, very, very low dose, that is in microgram dose. And these medicines are tested to be safe for decades together. These medicines are there in the market for about 30, 40, 50 years. And your doctor is definitely knows it, what is the dose which you should use to reduce, to get the best benefit, but to make sure that there is hardly any side effect or no side effect. So that will be, your doctor will be focusing on that. Now when it comes to medications in nose allergy and chest allergy, that is allergic rhinitis and asthma. In allergic rhinitis, the nasal sprays are given. One is a medicated nasal spray which your doctor will advise you the dosage and the duration. But my sincere suggestion for you is to not to avoid without asking your doctor. Your doctor also wants to reduce the medications as soon as possible, and it takes some time to reduce the medication. So that's the reason you need to visit every 3 months to see that your doctor decides whether medication should come down, it should be stopped, or it should be increased if there is any season which is worsening. So let him make a decision on that. There are certain saline nasal sprays to remove the mucus or reduce the nasal block. That also needs to be used on an as advised basis. In asthma, the usual medications which are given are inhalers. Different forms of inhalers are available, and different methods are available for different age groups. As I already told, inhalers have significantly about 100 times, 1,000 times lesser dose than your oral medications, and it is safer than the oral medications when used for long term. Now for asthma medications, you need to use inhalers, age-appropriate inhalers, that is for less than 4 years. There are certain medications which can be used in a certain spaces, certain face masks are there, which you need to use it in a correct way. Please, again, there are specific videos for that. Please watch them. For each one, wherever there is a video requirement, we have shot a separate video and it is available for you. Please watch them for the age-appropriate, correct usage of the medication and technique. In fact, correct usage of the medication technique is important to reduce your symptoms, to reduce the side effect of the medications, and hopefully this will help you a lot in reducing and weaning off medications. There are, for above 4 years, the medications are little might be different, or dosages might be different, and even the spacers available might be little different. Please watch separate videos. Rotahilar is another form where you will get it in capsule, which you will be using it. So that's an again inhaled medication, like a powdered medication. That's called dry powder inhalation. Autohaler. These are all the medications which are already pre-filled. You just have to keep it in the mouth and suck it. Again, there is a perfect technique to use it. You need to use that in a perfect technique. Please watch the videos. Nebulizations are generally used in emergencies. Nebulizations are okay to use it intermittently, occasionally, but if anybody requires a more frequently or longer time, nebulization is not a good option, and nebulization is definitely useful if a patient is having severe breathlessness. In that case, prefer to use an oxygen-driven nebulization, not a machine-driven nebulization. So please note, nebulizers are okay for short term, but not for long term. So we also should know what is emergency management. We do come across many children and patients suddenly coming with breathlessness. In fact, every day we see few patients coming with low oxygen saturation. Now, ideally, there is something called asthma action plan. What is asthma action plan? Here, we will going to train you and teach you how to manage your asthma if it is worsening, when you should manage yourself and stay back at home, and when you should start your medication and rush to an hospital. Again, specific in your clinic or in your center, your doctor or your assistant will teach you, customized for you, how to apply this asthma action plan. In briefly, if you have to say, there is something called peak flow meter. Peak flow meter is an instrument which is given to you for measuring your lung function every day. preferably twice a day. If not at least once a day, you need to blow forcefully into that particular meter, and that will tell you how your lungs are on a given day. The two important advantages are, if you're doing it regularly over a period of few months and years, you see how the peak flow meters are improving and you get the confidence that, yes, your lungs are growing well. Similarly, peak flow meter will show that if you are having any mild cough wheezing, the values will go down and it will tell you that, yes, something is going wrong. And it will also guide you if something is really going wrong in a significant way, the values will go down and it will tell you, please start a medication and immediately rush to an hospital. So kind of it is going to warn you before actual severe problem happens. In asthma action plan, we have something called well-controlled, partially controlled and uncontrolled asthma. In well-controlled situation, what you should do is, you will be comfortable, you will sleep well, your activity is good. Once or twice you will use in short relievers like salbutamol or anything, but otherwise your peak flow is above 80%. So you just have to continue your medications and follow that till your doctor has advised. Now there are certain situations like partially controlled or getting worse. Okay, you need more short-term relievers to use more frequently, more than 3-4 times in a week. And your sleep is getting disturbed, your activity is getting disturbed, and your peak flow is between 50 to 80%. Above 80% is, that means you are doing reasonably well. But if it is between 50 to 80%, that means something is going wrong. So here, you will continue your preventer medicine. Maybe you may have to even increase your preventer medication than what you are using it as per your doctor's advice. Make sure you're using a spacer and a correct technique. You should use a relievers like say 4 to 6 puffs every 4 to 6 hours. See how you are doing. If you are doing improving very well and your symptoms are going back and you are doing better, then you can stay back. If you are not doing well, the symptoms are worsening, then please make an appointment with your doctor. And what is emergency is you need to use reliever very frequently in a day, 3-4 times a day. Breathing is difficult and you often wake up with asthma, peak flow is less than 50%. This is an emergency situation. You should use reliever as frequently as possible till you reach your hospital, and you should take some medicine called prednisolone, which your doctor would have given a particular dose, and reach a nearest hospital as soon as possible. Following this, many of the patients, they'll be able to identify when they are getting worse and they manage themselves, and they also know when they are getting too bad so that they rush to the hospital. In summary, follow your doctor's advice and do not stop the medications without consulting your doctor. There are times that if it is a 3-month, you might not be able to visit it after 3 months. It may take a little longer time. It's all right. Please continue your medication till you visit your doctor. Correct technique is very, very, very important. Please make sure that the correct technique is followed. And please make sure that you have a very good knowledge about what to do when something goes worse. The next important step is called natural methods. Now, these are all natural methods which are very beneficial for you to feel good, for you to reduce partly your medications, and also improve your lung capacity and volumes. The 3 components are exercise, yoga, and home remedies. Now, in exercise, any exercise is good for allergy and asthma. Many of the patients, when they do some activity, they feel more breathless. The point here is, talk to your doctor, get an adequate treatment, and make the child continue to do that activity. Many patients and parents stop doing that activity because doing that activity causes them breathing difficulty. They stop doing activity. That is the worst thing which you can do. This will lead in future to yourself or your child becoming more and more vulnerable. So, please follow up your doctor's advice. Certain things are good warm-up is very important before activity. Try breathing through the nose as much as possible. And have your rescue medications. Whenever you feel breathless, take a rescue medications and a plan from your doctor how to prevent this. Any exercise is beneficial for allergy asthma because when you do exercise, like your body, your lungs also will have more capacity to take in more air, to breathe more easily. But it may take some months and years. What we generally suggest is swimming and pranayama are supposed to be very good for allergies and asthmas. At least 4 to 5 days in a week is important. 1 hour sparing it for that every day. once in a week or once in a 15 days you do some activities of no use at all. However, you like football, your child likes basketball, your child likes badminton, please encourage him whatever he wants to do. No restrictions on anything that particularly he has to do only this. Breathing exercises like pranayama is very, very, very important. It's a very good meditation program, calms down your immune system. It also opens up your lungs. And Jalaneti is something which water goes through one nostril and comes out through another nostril. We have specific videos for these things. Please watch these videos. Otherwise, we would tell, visit the nearest yoga specialist, ask him to train you for good pranayams and Jalaneti so that this will help you a long way in reducing the medications. Home remedies wise, please avoid as much as cold air directly coming in contact with the patient. Drink warm water and drink warm fluids. That is very beneficial whenever the child is having back-to-back cough. Honey with ginger paste is good for pharyngeal or throat cough. Sleeping in head side elevated is also beneficial sometimes. Steam inhalation is supposed to be used very carefully. We would suggest that steam inhalation keeping directly nearer to the face definitely is more harmful. And steam inhalation, if it is done at a quite a distance, at least minimum 2-3 feet from the child. In summary, natural remedies are quite important in helping us to reduce medications. Exercises are very good for an allergy and asthma. They should do whatever exercise they love and enjoy that. Yoga and breathing exercise should be made part of your daily life. More importantly, be consistent. Doing something when you visit a doctor for a few days and forgetting it doesn't make any sense. The next and the last component which we are going to discuss is immunotherapy. Many of the patients will come and ask, should we be on the medicine for lifetime or long term? Yes, there are some patients who need medications for long term and lifetime, but your doctor decides requirement for the medications as and when he keeps seeing you and based on your symptoms. Now, one of the long-term relief which you can get from allergies is by immunotherapy. What is immunotherapy? Basically, immunotherapy is nothing but making your body immune system what is working in wrong direction to make it work in a right direction so that you tolerate them. Take an example that you are allergic to certain pollens or dust mite. So your body is reacting to that whereas another person's body is tolerating it. Immunotherapy tries to make your body also tolerate the dust mite, also tolerate the pollen. And there is good scientific evidence that immunotherapy can give you relief of your symptoms, can reduce your medications, and the benefit persists for long term, as long as sometimes about 10 to 15 years. And immunotherapy can prevent newer allergies also. There are two types of immunotherapy. One immunotherapy is sublingual, where the drops are placed below your tongue. Whether you need immunotherapy or not, what kind of an immunotherapy is decided based on your allergy test, and your doctor will decide what is good for you. But important is immunotherapy needs to be continued for 3 years. The dosage, everything you need to discuss with your doctor. And subcutaneous immunotherapy is an injectable immunotherapy. Sublingual, it is taken very frequently, daily or alternate day. But injectable immunotherapy is taken weekly once sometimes, and after some point of time it might even go to about once in 15 days. So injectable immunotherapy has got its own advantages. Now each one, sublingual immunotherapy or subcutaneous immunotherapy, which one to go for, again it is a decision between your doctor and yourself. Again, the advantages are same advantages, that it is going to work for a little long time. It will reduce your medicines, it will reduce your symptoms, and there are many good number of patients who can come out of these medications completely and be only on immunotherapy also. In summary, immunotherapy is got one of the novel method and makes a big difference in allergies. It's a doctor and patient decision. Duration is for 3 years, and it has shown that immunotherapy can reduce your medication, and overall patients who are on immunotherapy, the overall cost of treatment also comes down because your medication dosage comes down, your number of medical visits comes down. Now, dear friends, I have discussed the 6 steps in management of allergies. Please note, your doctor will do his part, but there is a significant part you should do, or for children, their parents should do, to help the doctor to reduce the medications and possibly get away from the medications. So it's a journey which we are going together. Your doctor and our team is there to help you out. So you need to play your role and we will play our role. The total final outcome, what we want, final benefit, what we want is either yourself or your child should live a good quality, happy life forever. Thank you. And I request you to, as much as possible, follow this, and wherever you have a doubt, discuss with our allergy asthma assistant or with your doctor. Thank you.